Hello everyone, my name is Elizabeth Larios, and today for my final project I decided to focus on schizophrenia. This is a psychological disorder that affects how a person thinks, feel, and behave. People with schizophrenia can experience things like hallucination, hearing voices, or seeing things that aren't there, delusion, disorganized speech, and changes in motivations or emotions. Here I want to use a real video for my project so that you could hear from myself a real story that I currently live with my boyfriend. I met him 7 months ago. I have never dealt with someone with this mental disorder who lived with this condition, and this video I choose it as a short documentary that follows his treatment and when he was diagnosed with the schizophrenia, along with his mental health professional who explained the symptoms and treatment. What stood out to me most was how honest and personal this story is, as these aren't just a case from a textbook. This is a real story. Here I was sharing what his daily life looks like. From my personal research and from this video, I learned about these three main categories and symptoms. The positive symptoms like hallucinations and delusions. When we met, he's starting to hear voices. And when we were in the living room watching a movie, or sometimes I was just doing my homework and he just suddenly said, "Do you say something?" And I said like, "No, I haven't said anything." And then suddenly he's starting to see the delusions to make things real, but it was not real. When he sees, I see something walking by, and I said like, "What is it?" It go upstairs. So I went and checked, and there was nothing. So I was like, I think that's not normal. But I started to see more, and seeing more things in him very often. uh, the negative symptoms like reduced emotional expression or lack of motivations. He's starting to sleeping more. He's starting to not feel like active like he used to when I met him. His emotions and constantly changing and getting upset for right away for anything. So I started to see those changes, the cognitive symptoms like trouble focusing memory information too. Sometimes he doesn't remember stuff and we're talking something and he changed the topic. He changed the conversation. And so I called the mom and I talking to her, and she told me, "Oh, he haven't told anything." And I said like, "No." Well, when I was pregnant of your boyfriend, I don't want to say the name. I want to keep it private. We say when I got pregnant, your boyfriend, I got um, a disease that's called chicken spots. So I went to the doctor, and the doctor told me they give me two options to get abortion, or if I decided to have your boyfriend, he will born with maybe with the arms or with the legs. Even the risk, after I heard, I decided to have your boyfriend. My boyfriend has been grow up and develop positive symptoms, and like I say, hallucinations and delusions, and then she started to go to different doctors and treatment. He developed this at the age between 9 and 12 years old. After that, he was treating with medication and follow up his doctor's appointment. When I met him, I didn't see he taking any medications or being able to taking care of himself or tell me anything. Well, I learned that the exact cause of the schizophrenia isn't fully known, by factors like brain, chemistry, genetics, and stressful life events may all play a role. In this case, was his mom. But tense about the early diagnostics and the symptoms she's starting to see, and she's starting to treating, taking him to the doctor. But it's really important is helping people manage these symptoms. This project has a personal meaning for me because I plan to keep working in healthcare, and I know I will meet patients with mental health condition. And understanding disorders like schizophrenia will help me respond with patients' empathy and respect. I currently go with my boyfriend to his doctor appointments. We're starting to involve more in a community. We're starting to involve more him by going out, talking. He's taking his medication, his follow-up, all his doctor instructions. He's if you see him, he's acting like normal, and then all the hallucinations, the delusion was gone. They're no longer there. He's taking his medications, and we are getting along, and thanks to the doctors and the community help, it has been working a lot. We have met a lot of people with the same disorder, but it has been treating the schizophrenia is not that bad, it's not that strong, but with the medication is helping a lot. Well, I hope my presentation helps you to see the beyond and diagnostic schizophrenia doesn't define a person. It's just one part of their life story. With the right care and support, people with this disorder can live happy life, with all support and love. Thanks for listening. Have a wonderful day.